Now I just want to discuss the different individual effects of different on the different organ system. So first of all, how prostaglandins affect the CNS. Yes, CNS, the PGI1, the PGE1 and PGE2, these are the pyrogenic prostaglandins that are seen near the CNS. So what can be done? You can prescribe the NSAIDs to reduce the fever, because these are pyrogenic, and you can prescribe the NSAIDs so that they can reduce the fever. Then we have the action of these on the peripheral nerve endings. So near the peripheral nerve endings you have the PGE2 and PGI2, and these are going to sensitize the body or sensitize the peripheral nerve endings to the pain. Okay, and that's how the NSAIDs, if these are prescribed, they are reducing these prostaglandins, and hence they will be producing what? They will be producing pain relieving effect. Then we have the CVS. Yes, on the CVS we have the vasodilation action by PGE2 and PGI2. We have vasoconstrictive action by PGF2 alpha and thromboxane A2. We have capillary permeability increasing action by PGE2, and we have patent ductus arteriosus actions as well. Now you must have seen or heard that patent ductus arteriosus is there, and to close that patent ductus arteriosus we give aspirin to the patient or the child, right? Then we have the action of these prostaglandin on the platelets. Now when it comes to the platelets, yes, you have to discuss the PGI2 effect. PGI2, that is prostacyclin, this inhibits the platelet aggregation, and its synthesis is generally going to occur in the endothelial cells, and endothelial cells have nuclei. That's why if it is inhibited by the NSAIDs also, later also these endothelial cells can be producing the new COX enzyme, and that's why they can regain or they can resume their synthesis. Then comes the thromboxane A2. Now this thromboxane A2, which promotes the platelet aggregation. Remember, these are very important for exam. These are synthesized in the platelet. Okay, and we know platelet do not have the platelet are not going to have what? These are not going to have the nucleus, and that's why these are not going to be resynthesized later. Okay, then comes the action of these on uterus. When I discuss uterus, yes, they have PGE2 and PGF2 alpha. These are going to have uterine stimulant effect. Okay, they cause severe uterine contraction, and that's why they can be used for early abortion as well as the midterm abortion. So it is not that important, but there is PGE2 analog, that is dinoprostone, and there is PGF2 alpha analog, that is carboprost. These are given for causing the abortion as well. Okay, then comes the bronchus. Now how these PGs are going to affect the bronchus? So we have PGI2 and we have PGE2. Now this PGI2 and PGE2, these are the bronchodilators. So whenever there is an acute asthma, so the aerosols of the PGE2 can be given to the patient. Now some prostaglandin and thromboxane are going to be bronchoconstrictor as well. These are thromboxane A2 and PGF2 alpha. So you have to understand here that if you are giving aspirin to the patient, right, you will be blocking the COX pathway, but arachidonic acid is already there, so that will be converting and making more and more leukotrienes, and these leukotrienes are also precipitative of the asthma, and that's why aspirin can also precipitate the asthma. So that is an important point or takeaway from all this discussion, which is beyond the PGs here. Then comes the GIT. We have been talking about this since the starting of this video. GIT, we have PGE2 and PGI2. These are going to decrease the acid secretion, and they will be promoting the mucus production. Same way kidney, we are talking kidney. Yes, they are going to increase the kidney perfusion. How? By renal vasodilation. They are going to increase the renal clearance. They are going to promote the natriuresis. Then we come to the eye. Now the PGF2 F2 alpha that decrease the intraocular pressure. So where can you find the use of this? You can of course find it in the glaucoma. Then comes the male reproductive system, where PGE2 and PGI2 can play an important role in mobility of the sperm, as well as they can help in penile erection, and that's why that can be given in the erectile dysfunction disorders.